Welcome to this Seizure Smart training, which is presented by the Epilepsy Association of Utah, who provides services to individuals who deal with the challenges of epilepsy and seizure disorders. In this presentation, we'll describe common types of seizures, how to apply seizure first aid, and what to recognize when a medical emergency is taking place. We'll also talk about support and advocacy for someone diagnosed with epilepsy. Let's begin. So what is epilepsy? It's a chronic neurological disorder that is characterized by recurrent seizures. There are a wide range of seizure types, and we'll cover some of the most common ones in this presentation. Epilepsy has some common causes that include head injury, infection of the brain, stroke, brain tumor, Alzheimer's disease, and genetic factors. It's important to note that 70% of epilepsy diagnoses can't be traced to a known cause. Epilepsy can be diagnosed through a patient's history or with neurological examination. You can also use blood work for genetic factors or other clinical tests. Additionally, eyewitness accounts can help determine the seizure type. Seizures can have a profound impact on personal safety, relationships, work, and driving, but the stigma of seizures can often be a bigger problem than the actual seizures. So let's describe what a seizure is. A seizure is a brief, excessive discharge of electrical activity in the brain that alters a person's conscious control over awareness, movement, sensations, and behaviors, and is influenced by the excessive stimulation the body experiences from the brain. In most cases, there is either a lack of movement, sensation, and behavior, or there is an excessive amount of movement, sensation, and behavior. Seizures are defined as either generalized seizures, where both sides of the brain are affected, or partial seizures, where part of the brain is affected. The most widely recognized type is the tonic-clonic seizure, which was previously known as a grand mal. Tonic-clonic refers to two phases of the seizure, the tonic phase, or stiffening of the body, followed by the clonic phase, or convulsions. Symptoms may include a loss of consciousness, and the person may fall to the ground and begin to convulse. The seizure can last anywhere from 1 to 3 minutes, during which time the person may have very shallow breathing and can drool. Sometimes there's a loss of bowel or bladder control, and the skin, nails, and lips of the person may turn a bluish hue. Absence seizures are the other type of generalized seizure, and may be confused with daydreaming or lack of attention, or even may be mistaken for an attention deficit disorder. Symptoms include a brief lapse of awareness where the person will freeze or stare into space. They typically last only 1 to 10 seconds, and that makes them hard to see. They can occur several times a day, during which time the person is unaware of what is happening. They may not even know that a seizure has occurred. Let's look at the other category of seizures, which are the partial seizures. This type of seizure is actually the most common and involves only a part of the brain. People with this type of seizure may experience an unusual taste or smell or feeling. Simple partial seizures have symptoms where the person remains conscious, but their awareness is maintained or altered. They may display isolated rhythmic movements like a twitching of their arms, head, or legs, and they could have altered senses, so tingling feelings, a weakness, sounds, smells, tastes, nausea, or visual distortions may appear. They could also experience altered psychological senses, so an experience of déjà vu or hallucinations, a feeling of overwhelming fear or anxiety, or feelings that just can't be explained. It's commonly confused with acting out or having a mystical experience, and in some cases it's treated as a psychosomatic or mental illness, and it is none of those things. It is a seizure. Complex partial seizures are similar to simple partial seizures, but involve more parts of the brain. Awareness may be impaired, and the person may actually lose consciousness. This table presents a summary of the information about seizure types. Although tonic-clonic, absence, simple partial, and complex partial seizures have been described, it's important to understand that each person who has a seizure will have a unique experience based on the part of the brain affected, how intense the seizure is, and how long it occurs. The postictal state is the altered state of consciousness after an epileptic seizure. It usually lasts between 5 and 30 minutes, although it could be longer, and is characterized by drowsiness, confusion, fear, or anxiety, and physical symptoms like nausea or headaches. Some people recover immediately, while others may take hours to feel like their normal self. The type of seizure as well as what part of the brain the seizure impacts, affects the recovery period, how long it may last, and what may occur during that phase. Let's take a look at these statistics that were compiled or derived from information provided by the Center for Disease Control, the Epilepsy Foundation, and the U.S. Census. Approximately 11 million Americans have epilepsy, and 1 in 10 will have a seizure at some point in their lives. It's important to note that having a seizure doesn't always mean that you have epilepsy. In Utah, it's estimated that over 110,000 people have had a seizure. It's also estimated that anywhere between 11,600 to 29,000 people in Utah have active seizures. In the U.S., a person is diagnosed with epilepsy on average every 3 minutes. Epilepsy is also more common than cerebral palsy, Parkinson's disease, muscular dystrophy, and multiple sclerosis combined. Did you know that epilepsy is not contagious, that you can't catch it from someone else? Epilepsy is not a mental illness, and by itself, epilepsy does not represent any type of cognitive delay. Individuals with epilepsy cannot swallow their tongue during a seizure. It's physically impossible. People with epilepsy may not be aware of a seizure, and they probably won't remember what happened. Epilepsy is a neurological condition with a medical diagnosis. We'll talk more about this when we discuss first aid. Let's take a look at what can trigger a seizure. For some individuals with epilepsy, missed or late medication can be a serious problem. Additionally, prescription and over-the-counter medications can sometimes combine to cause adverse reactions to AEDs, or anti-epileptic drugs. Conditions that reduce a person's tolerance, so stress or anxiety, lack of sleep, hormonal changes, illness, poor diet, or missed meals can be contributing factors. Additionally, external triggers like flashing or strobe lights, hyperventilation, which may be a concern if induced by exercise, temperatures where it's too hot or too cold, or even altitude can cause a seizure. For some individuals who do not have epilepsy, untreated diabetic hypoglycemia can lead to seizures, or excessive alcohol or drug use. So how does epilepsy impact life? Memory problems are one of the most significant issues. Remember that seizures alter consciousness, and that recovery following a seizure may take a long time, during which both short-term and long-term memory are affected. In context of work, classroom, or social settings, it may be necessary to repeat information like directions, instruction, or discussion. There are transportation issues. In Utah, an individual should be seizure-free either on or off medications without side effects for at least 3 months. You can refer to epilepsy.com/driving-laws for links to driving laws for Utah and other states. Finally, anti-seizure medication has side effects that can cause drowsiness, inattention, concentration difficulties, or even behavior changes. These side effects are more noticeable when medication is introduced or when doses are changing. Common types of treatment for seizures include medication or diet, but can extend to implanted devices or surgery. Medicine can be taken in pill or liquid form with one or more prescriptions in combination. Rescue medications include diazepam rectal gel or intranasal midazolam, which are used in acute or emergency situations to stop a seizure that will not stop on its own. The ketogenic diet and modified Atkins diets are used primarily to treat severe childhood epilepsy that has not responded to standard prescription anti-seizure meds. Ketogenic diets are based on placing the body into ketosis, which is a fat-burning state that has an anti-seizure effect. It is a high-fat, low-carbohydrate, and moderate protein diet. These diets are typically administered by a nutritionist and require strong family, school, and caregiver commitment. There is no deviation on this diet. Implanted devices include the vagus nerve stimulator, a device implanted just under the skin in the chest with wires that attach to the vagus nerve within the neck. This can be used primarily to treat partial seizures when medication is not effective. The patient may still require an AED or anti-epileptic drug. Surgery includes partial removal or a disconnect of affected parts of the brain. So, how can you be an advocate? Stay calm when assisting a seizing person. Your disposition is important. Knowing what to do and when to do it will help. know first aid for seizures and when to call 911. We'll cover this in the next slide. Be supportive. Know how to explain seizures to others, particularly the type of seizures that you or the person affected could experience. You'll want to encourage peer interaction. You can invite classmates or coworkers to discuss seizure response and be open to questions and seek opportunities to inform others. Most importantly, you'll want to avoid overprotection and encourage independence. This can be difficult for parents. Provide adequate protections, but encourage a normal lifestyle. You can contact the Epilepsy Association of Utah for more information on how you can be an advocate. We've reached an important topic in this presentation, and that's how to administer first aid to someone who is having a seizure. First, it's important to stay calm. Track time or call someone near you to track the time. Unless you know the person's seizure history, it's recommended that seizures which last over 4 minutes need to have a 911 call placed. Turn the person on their side so that their airway remains unobstructed and so that they don't choke. Place something soft under their head and loosen any ties or neckwear that they have. Clear the space around the person and identify any potential objects that may harm them. Most importantly, don't leave. Stay with the person and be reassuring. Remember that the person having the seizure may be conscious but unable to respond. It's also important to know what not to do when administering first aid. Do not put anything in their mouth. Putting objects in a seizing person's mouth is a myth. It's physically impossible for someone to swallow their tongue, and putting an object in someone's mouth during a seizure will likely hurt them and could hurt you too. Remember that rescue medications are administered by a responder as either a rectal gel or an intranasal spray. Do not attempt to give food or water to someone having an active seizure because that can be a choking hazard. Remember, don't put anything in their mouth. Finally, don't attempt to hold down or restrain a person having a seizure unless you're protecting them from falling further or from a nearby object. When should you consider a medical emergency and call 911? If the seizure lasts more than 4 minutes, especially if the person has no prior seizure history or if the seizure history is unknown or if there's no medical ID. If the person hasn't regained consciousness or has shallow breathing. If it is a woman who is pregnant, because a seizure could result in complications for both the mother and the child. If the person has diabetes, this is an example of a non-epileptic seizure. Remember that a seizure from untreated diabetic hypoglycemia can be life-threatening. If the seizure occurred in water, or if they have injured themselves during the seizure. These are all good reasons to consider a medical emergency and to call 911. For further information about epilepsy and for information about seizures and seizure response, visit the Epilepsy Association of Utah at epilepsyut.org or the Epilepsy Foundation of America at epilepsy.com. The Epilepsy Association of Utah is a statewide organization. You can find us on the web and on Facebook, Twitter, Pinterest, Instagram, and YouTube. Thank you for attending this Seizure Smart training.